Today's session is going to be focusing on COVID-19 vaccination for children with medical complexity. Our faculty presenter is Dr. Sean O'Leary. Sean O'Leary is a professor of pediatrics at the University of Colorado School of Medicine and Children's Hospital, Colorado, and is also a pediatric infectious disease specialist. Dr. O'Leary's research focuses on prevention of vaccine preventable diseases through understanding clinical and attitudinal and infrastructural barriers to vaccination and developing and testing interventions to address these barriers. Dr. O'Leary is a member of the American Academy of Pediatrics Council and School Health and serves as the vice chair of the Committee on Infectious Disease, the Red Book Committee for the AAP. He also serves as a liaison to the CDC's Advisory Committee on Immunization Practices for the Pediatric Infectious Disease Society and currently represents the AAP on ACIP's COVID-19 vaccine work group. I'm going to turn it over to you, Dr. O'Leary.
Thanks very much for that introduction, and it's a pleasure to be here. I see some familiar names in the chat box, so good to see all of you. So go ahead and go to the next slide. I have no conflicts. Next slide. Yeah, this, and I'll touch on this throughout the talk, but this is an evolving pandemic. What I tell you today may not be true tomorrow, but might be true again the next day. So things are changing very quickly, and so we have to keep that in mind as we talk about COVID. Next slide. And so our objectives today, one is to be able to explain the current COVID-19 vaccine guidance for children, including children with medical complexity. And then the second is, my hope is that you'll understand some strategies and tips for talking with families about COVID-19, including discussions around safety and efficacy. And some of that may be better in the discussion section as opposed to the presentation section. Next slide. So we came out with this, I guess 2 or 3 weeks ago now. This was the official policy statement from the Academy as crafted by the Committee on Infectious Diseases for COVID-19 vaccines in children. It's not a very long policy statement, and it essentially lines up with CDC and ACIP in terms of the recommendation for all eligible persons at this time 12 and older. Next slide. And this is getting into a little bit of the specifics. So the AAP is recommending vaccination for all children 12 and older who do not have contraindications, and we'll talk briefly about those. And then basically any COVID-19 vaccine authorized through EUA by the FDA and recommended by CDC can be used for COVID-19 vaccination in children and adolescents. Currently, there's only one vaccine, but we can talk some more about the others. And then the other big issue, of course, was the co-administration issue. You may remember that initially when these vaccines were rolled out, CDC recommended against using any other vaccine within the 2 weeks before and 2 weeks after vaccination with COVID-19 vaccine. And that was primarily for safety concerns as we were rolling out these vaccines very rapidly to a large population. We wanted to be able to see if someone had a reaction after a vaccine. We wanted to make it as uncomplicated as possible and not make it seem that it may be from another vaccine and get confused there. And so as millions and millions of doses accumulated and we got a better picture of the safety situation post-authorization, that became less of a concern. And the bigger concern, of course, became the big drop in routine vaccination coverage, both in children and adults. And so considering the risks and the benefits, that decision was almost unanimous to go ahead and eliminate that 2-week window there. Next slide. So these are the vaccine brands. Again, Pfizer-BioNTech is the one that is recommended now for people 12 years and older, 2 shots given 3 weeks apart, and generally considered fully vaccinated 2 weeks after the second shot. There, of course, are a lot of questions about the variants, and we can talk about that. But so far, it looks like all of these vaccines actually offer very good protection against the variants. The other thing I should point out here, and I'll point out later in the talk as well, is that the efficacy of these vaccines is particularly in the clinical trials for these mRNA vaccines, the Pfizer and Moderna vaccines, was well beyond anyone's wildest expectations in terms of preventing symptomatic disease, and even better for the outcomes we care the most about, which are hospitalization and death. Essentially, almost 100% protection. We've seen post-licensure some breakthrough cases, of course, but they are in line with what we would expect based on the clinical trials. So these vaccines really are, I think, we can talk about some of the issues around them, but the fact that they are as effective as they are is really a gift. Next slide. Now, in terms of what's going on, I mean, lots of research going on with these vaccines right now. Pfizer-BioNTech is testing its vaccine in children ages 2 to 11 and has announced that they expect to file an EUA for children ages 2 to 11 in September. Moderna is a few months behind with most of the childhood rollout, but they are also similarly going to be having vaccines probably authorized in the coming weeks for down to age 12 and perhaps late fall for younger children as well. So there may be 2 vaccines we're talking about for kids in the in the next 6 months or so. Next slide. Okay, so side effects, and we can talk a little bit more about this. One of the, I think I assume most of you are vaccinated, most of you probably had some level of short-term side effects. These are quite common, not really out of line with some of the other vaccines we have in the routine schedule, both for children and adults, but a little bit more in degree in terms of how often people get fever and things like that. These are generally self-limited and go away within a few days. Some people have no side effects. My wife was down for a day or two with her vaccine. I had a sore arm. Neither of my kids really had much in the way of side effects beyond a sore arm. So it really varies. Next slide. Okay, so myocarditis, this of course is all over the news after the Pfizer vaccine. There were initially some reports out of Israel a few months ago that gave us some hint that this was perhaps a side effect. And this is a very active area of investigation. And I mentioned that what I tell you today may change tomorrow, and that's literally true in this case. There will be an emergency ACIP meeting, one part of which is to address this issue, and that will be on Friday. This past a week ago, the VRBPAC, which is a committee of external experts that advises the FDA, met on this issue, and there were some preliminary data shared there as well. So these are the details, and these come from CDC's website on clinical considerations for providers regarding myocarditis and pericarditis after COVID-19 vaccines. There was a case series published in Pediatrics last week of 7 cases that gave a little bit more detail about what these cases are looking like. As a pediatric infectious disease specialist, we've taken care of a few kids here at Children's Hospital Colorado that have perhaps had this reaction. It's still being worked out. Is it a real relationship? I can tell you, based on what was presented at VRBPAC last week, that the expected number of cases, just to give a bigger picture view of this, there's a pretty robust vaccine safety surveillance system in the US that's been in place for decades, really, that has kind of gone into high gear with these COVID-19 vaccines because we're rolling them out to such a large population so quickly, given the urgency of this pandemic, people still dying every day from this virus. And so these safety surveillance mechanisms have been really working around the clock to try and sort out what's a real side effect, what's not. And I think some examples of that we saw early in the pandemic or early in the rollout were anaphylaxis after mRNA vaccines, and then the cerebral venous sinus thrombosis and other thrombotic events with thrombocytopenia after the Johnson & Johnson vaccine. And those, we were able to detect those fairly quickly because of our surveillance systems that are in place. And this is another example of that. So what's happening right now is the VAERS, which is the Vaccine Adverse Event Reporting System, and the Vaccine Safety Data Link are the 2 main mechanisms that are looking at this, but they're looking at it through other surveillance systems as well to see, are we seeing more of this myocarditis and pericarditis than we would expect in the general population? Because anything that can happen after a vaccine can happen just without vaccination. And myocarditis happens fairly rarely, but it happens. We take care of it in the hospital, not infrequently. And what we're seeing now is that in the roughly 2 days after the second dose of vaccine, there does appear that there are more cases than we would expect given the background rate. It's still considered a rare event. What I can tell you about those cases are that they have generally been mild, meaning these children have been hospitalized, but they go home within a few days in most cases, and their cardiac function returns to normal fairly quickly. Now, in terms of what to do with long-term follow-up, right now the general recommendation is to handle this the way other cases of myocarditis are generally handled, so with the management of a cardiologist in terms of return to activity and things like that. The quantifiable risk is still being worked out. So is it 1 in a million doses? Is it 1 in 500,000 doses? Is it 1 in 50,000 doses? Those are the types of things that if it's determined there is a causal link, we will get some numbers about, what is the risk with this. At this point, even if this risk is real, the general consensus has been that even for children, that given the nature of this disease, the benefits of vaccination, even knowing this potential rare risk, continue to outweigh the potential risk. And again, very rapidly changing situation, so stay tuned. Next slide. Now, contraindications, these are actually quite rare. So contraindications in general for vaccination are quite rare. Anaphylaxis to a prior dose of vaccination is always a contraindication, and that continues to be the case here. And then there are specific allergies that are also quite rare. These vaccines actually don't have a lot of the same components that some of the other vaccines that are more likely to cause anaphylaxis can have, like gelatin. But there are a few things that potentially could be a rare thing. But these are things that generally would be known about prior to vaccination if you have one of these allergies. Next slide. And then again, history of anaphylaxis to these vaccines, of course, but patients with a history of a severe allergic reaction to something else, whether it's another vaccine or some other cause, the recommendation in general right now is just to monitor for a bit longer, monitor for 30 minutes. And then if someone does receive anaphylaxis after the first dose, they should see an allergist. Next slide. And then for children and youth with special healthcare needs and chronic medical conditions, the vaccines are generally considered safe for these children. These are not live vaccines, so even for children with immunocompromising conditions, these are generally considered to be no more risky than the general population. Certainly we all know that children with chronic medical conditions are at high risk for severe disease from COVID-19, and so certainly should be prioritized for these vaccines. Next slide. And then in terms of what can pediatricians do right now, of course, I mentioned at the top of this talk just about the big drop in routine vaccines, and I think it's important to remember that as for better or worse, as we return to some semblance of normalcy here in the U.S., we're going to be doing more mixing, and if we don't catch everybody up on the vaccines that have been missed during the pandemic, we could potentially be at risk for other vaccine preventable diseases that frankly are more severe in kids than COVID-19. And so we need to remember that and really do our best to catch our kids up. And then of course, promote vaccine confidence. We can talk more about that. And then knowing where people can get vaccinated. And those in most states in the US have really expanded in terms of options for places to get vaccinated. Next slide. And then this is just a reminder, of course, there are lots of evidence-based strategies that don't require any complex communication training in terms of talking to families, just simply implementing systems-based changes within the practice. that really go a long way to increasing vaccination rates. So things like standing orders for vaccination, reminders and recalls for vaccination, having vaccination-only visits, really making vaccination as easy and simple as possible, partnerships in the community, and then, of course, there are lots of toolkits available from the AAP and elsewhere to help with some of the messaging around vaccines. Next slide. And then I kind of already covered this. That's another important point, though, is of course regarding school. Don't forget about that issue. Of course, kids are going to need to be up to date on the required school vaccines to be able to return to in-person learning. Next slide. And then, in terms of promoting vaccine confidence, lots of stuff both on routine childhood vaccines, but also COVID-19 vaccines on the AAP website. We've been having, AAP has been hosting some town halls addressing vaccine hesitancy and building confidence. A lot of the local chapters I know are also doing the same thing. And then also, just of course talking with about COVID-19 vaccine with parents and caregivers within the office. I know this has been going on practically for a year now, as even before these vaccines were licensed, parents with lots of questions about them, or simply coming in saying, I'm not going to get them. What do you think about that? That kind of stuff. So we can talk more about that in discussion. Next slide. And then I mentioned this, that knowing that COVID-19 vaccine sites in your community, many states are really trying to make it feasible for pediatric practices to deliver COVID-19 vaccine in the office. I think if that's possible, and you can figure out the billing issues, because that's always that can be a real barrier. If you're having to devote a lot of staff time, but that you're not being paid by payers, if you can get that worked out, trying to administer these vaccines in the office are going to make it a lot more convenient. And frankly, for a lot of parents who may be on the fence about this, simply having it in the office and saying, hey, we can get it done now, that's going to overcome a lot of the parents who do have a little bit of hesitancy about these vaccines. Go ahead and go to the next slide. And then in terms of communication, I'll touch briefly on this, but again, we can cover this in the discussion. And I think as pediatricians, we're well used to doing a lot of this, listening to questions with empathy, doing our best not to judge, and certainly avoiding arguments. I mean, some of the concerns that come in obviously can be pretty outlandish, but we really want to understand where parents are coming from and really respect that, and try to do our best not to let it kind of ruffle our feathers as we're having these discussions, knowing that it's just parents trying to make the right decision for their children. And of course, the COVID-19 vaccines add a layer of complexity to this discussion because they are new, frankly. And there's certainly plenty of controversy in the media basically every day about this that we're not used to seeing with our routine vaccines. Of course, open-ended questions are going to be helpful. Go ahead and go to the next slide. And then also, I do a lot of work on vaccine communication using motivational interviewing as a framework. I'm sure many of you are familiar with using that for other reasons. And I think these principles fall under the principles of motivational interviewing. Basically working the first bullet is really about working towards the positive. So, trying to point out what are the benefits of vaccination and not focusing so much on the downsides. And then, of course, addressing their concerns with empathy, with facts, and the going from why not to the reasons for why. One technique some motivational interviewing trainers use is using a 0 to 10 scale. So on a 0 to 10, tell me where you are in terms of thinking about this vaccine for your child. And a parent may say, well, I'm probably at about a 4. And then you can say something to the effect of, well, tell me why you're a 4 and not a 0. Like using that technique, it sort of builds up their reasons for vaccination. Well, I know it's a severe pandemic, and I know my child is potentially at risk, and so getting into more of those and statements. And then also, of course, sharing your own reasons, sharing your own personal story. If you have children, what did you do for your own children? Those kinds of decisions. Next slide. And then, of course, I mentioned this already. If you have the vaccine in the office, that for those parents that are on the fence but you've had a good conversation with them, but perhaps it's still not their highest priority, having it in the office can help with that. But if you don't, really trying to help them make a plan for, when they're going to go get vaccinated. Next slide. So just to summarize, the vaccine, as I mentioned, is recommended for all children and adolescents 12 and older for now. And that's probably going to continue to be the case, at least for the next several months. I touched briefly on this EUA authorization. We can talk more about that, but I can tell you that the EUA mechanism, having really observed this process very closely and having been involved in regular licensure and recommendation processes over the years, was almost identical to what we see with typical vaccines in terms of the outcomes that were measured and the number of participants involved. I get a lot of questions about, well, what about long-term side effects? Since this in the EUA, they require 2 years of safety data as opposed to 6 months or 2 years. And what I can tell you about that is that actually long-term side effects that occur, side effects after vaccination, almost as a rule appear within 2 weeks, and almost never do they appear beyond about 2 months. And I have, it's essentially unheard of in vaccinations. And these vaccines, once they're injected, they basically do their work within a matter of hours to days, and then the components of the vaccine are gone. They're out of our system, and we're left with the immune response to the spike protein, the one part of the coronavirus. And so there's no reason to think that these vaccines are any more likely to cause quote unquote long-term side effects than any other vaccine. And so we don't really see that. Now, of course, this myocarditis issue is being worked out. I mentioned that most of the children that have myocarditis have recovered fairly quickly, but that's also something that's being watched very closely. I mean, if it turns out that this risk is higher than we expect, and if it looks like some of these kids aren't fully recovering, some of these recommendations may change. I don't anticipate that to be the case, but that's something that's being looked at very closely. And then I mentioned the co-administration. So I think we can I think the next slide is sort of a resources slide. So lots of different resources from AAP and CDC. Immunization Action Coalition, which is immunize.org, has lots of great resources. That's another message that I've been trying to get out there, both for parents and for pediatricians, is really be careful of your sources of information. It's always true that there's lots of misinformation out there about vaccines, but that's particularly true right now. Be careful what you see on social media. Be careful what you see in the newspaper even. Really look for trusted, reliable sources of information. And I will stop there.